So Walgreens is set to close down 1,200 of its locations. Walgreens Pharmacy. CVS has already closed 900 of its locations between the years of 2022 and 2024 and is set to close down 270 more. Okay? Rite Aid has been bought out. They've 810 of their stores have already been bought by a private buyer. And they're looking to close 316 more. All the major pharmacy retailers shutting down, filing bankruptcy. And I can't help but think about who keeps pharmacies in business. Their main clientele. Sick people. And then last time I checked, there's always sick people. There's always sick people. Pharmacies closing down and mass closings should be just as alarming as if the hospitals were to start closing down in mass closings. Because what do you mean? What do you mean you don't have the clientele when there's always sick people? So I decided to do some research. A CDC publishing in 2024 based off of the National Health Interview Survey data states that 8% of Americans are uninsured, as in 8% of Americans do not have health insurance, okay? And then an estimated amount of 27.1 million Americans of all ages are also uninsured. They do not have health insurance. So now everything is starting to make sense. If your clientele, the sick, are uninsured and they don't have the funds to make out-of-pocket expenses for their health, guess what? You have no business. You have no business. And this is what I want you guys to think about. This is affecting the pharmacies. What makes you think it's not going to affect the hospitals? They have the same clientele. The same clientele, sick people, okay? Sick people. More and more people do not have health insurance. They cannot afford out-of-pocket costs for health, okay? Do you know how expensive an asthma pump is? Do you know how expensive diabetes strips are, test strips are, and needles? Do you know how expensive that is? Insulin? They don't have it. And now you have this administration trying to propose bills such as the Big Beautiful Bill that wants to cut $880 billion from Medicare. That would leave 10.3 million people without coverage and then 7.6 million people without insurance on top of the number that we're already dealing with. You have Idaho health providers currently, right now, I kid you not, look it up, desperately pleading. They're pleading for help. Why? They're pleading for an action because the state is facing losing $3.5 billion in Medicaid. That's what they're facing right now. They are facing a $3.5 billion cut from Medicaid for their state. And they're literally calling out for a cry of action right now for help. Retail stores like Macy's, Forever 21, all of them closing. It's sad. Okay, an era is gone, but it's all right. It's retail. Pharmacies closing down in mass numbers. Before you know it, it's going to be hospitals that are closing down in mass numbers. Because again, like I stated, they have the same clientele. The same clientele. Whatever you cannot afford at the pharmacy, you damn sure cannot afford at the hospital.